Hey, welcome everyone. Thank you for being here today. My name is Maura Canavan, and I am with the Community Health and Wellness Department at Suburban Hospital. Today, we are joined by Kim Coleman, registered nurse and doctor of acupuncture, to discuss traditional Chinese medicine. We will have time for questions at the end, but please feel free to type them in the Q&A box as they arise. We will also be utilizing the chat function to have some interaction during this webinar. Thank you so much, and I will now turn it over to Kim.
Thanks so much, Maura. I'm so excited to be here. Seems like we have a great turnout. There's lots of information to share. So again, if you have any questions, just type them in the Q&A section and we will go over those at the end. So we're going to be talking about springtime today. And I just want to take a moment to introduce myself. I've been a registered nurse since 2003. I've also been studying and practicing traditional Chinese medicine since 2012, and that included 4 years of study in China. Some areas of specialty include cardiovascular conditions, psycho-emotional and stress-related illnesses. I studied with 2 different masters in China, along with getting my PhD there. And their specialties were Tuina, which is a Chinese medical massage, and also scalp acupuncture for neurological conditions. My Chinese name is Jinbo Li. That was gifted to me by a Taiwanese friend years ago. So some disclosures before we start. The information that's in this presentation is just for educational and information purposes only. Don't try to self-diagnose or treat. Seek a professional. And I have 2 hats. I'm also a nurse at Suburban, but for the purposes of today's presentation, I'm not representing Hopkins or Suburban or their affiliates. The objectives of today, I'm going to start out with an introduction of TCM theory, acupuncture, and other modalities that are included in traditional Chinese medicine. Then we're going to talk about some spring dietary suggestion and some tips and tricks for emotional self-care. Also, we'll go over some allergy remedies, which include some acupressure points to help with your seasonal allergies this spring, and how you might treat some strains and sprains from a traditional Chinese medicine perspective. And then, of course, we'll have questions at the end. So what is traditional Chinese medicine? It's been around for thousands of years. It's changed a little over the centuries, but the basic concept is this vital life force called qi that is in our bodies. And an imbalance of that qi from a traditional Chinese medicine perspective is what causes disease and illness. So what makes up that qi are these complementary and opposing forces called yin and yang. And I want to start out by just asking, how many of you have been exposed to Chinese medicine? And so maybe you know, what is yin? What are some things that represent yin? If you want to type those into the chat. And maybe Maura, you could read those out to me since I can't see the chat.
Sure. Let's see.
Or maybe we don't know, and we're going to learn a lot today. Also, maybe some things that represent yang. We can go over those together. So what are yin and yang? Some aspects of yang are considered the heavens or the sky, also the masculine, rational thought, things that are hard, things that are light. The sun is considered yang, and the fire element. And the opposite of those are yin. So the earth, the feminine, the emotional, things that are soft and heavy. The moon is considered yin as opposed to the sun, and water. And then these yin and yang aspects, they relate in different ways to one another. So there's movement and stillness. This concept of impermanence is very important in Asian philosophy in general, but also in Chinese medicine. And they find balance and harmony mutually supporting one another. And there's also an aspect of building and storing. So these oppositional forces that are still working together in a unified manner. So in order to regain the balance when there's an imbalance, the internal body organs need to be aligned with the external elements. And in Chinese medicine, there are 5 elements: wood, fire, earth, metal, and water is the order that I learned them in. So these are the 5 elements. And today's, we're going to talk mostly about the wood element because that corresponds with the spring season. There's lots of ways in which these 5 elements interact with one another. There's a generating cycle, which you see here on the right. So you can imagine like the well springs of water deep in the earth, nourishing plants that are growing. And then, of course, wood burns, and then that becomes ash and turns into earth. And then again, deep within the earth, metals are formed. And then the cycle goes around in a circle. There's also a controlling cycle, because everything needs to be kept in check. So we'll talk about the wood element today, but the wood controls the earth, and you can remember that by thinking about how the roots of a tree hold the earth in place so that it's not eroded. And metal controls wood, so you can think about an axe chopping down a tree. And with each season, we could talk about how these are controlled or generated, but today we're going to focus on the wood element for spring. So again, the spring season is correlated with the wood element, and it's about growth and creation. And I know generally we think of there being 4 seasons. So one way that Chinese medicine considers these 5 elements is a late summer season, which would be the earth element. Another way to think about that is this transition times between seasons as the earth element. But we're going to, again, focus on spring today. So there's also emotions that correlate with each of these elements. So in the springtime with the wood, the organ that's associated with wood is the liver organ, and the negative emotion is anger. The positive emotion is benevolence. And you can see the other emotions that are associated with the other organs here. So in the spring season, we can, if things are out of balance in our systems, we can have a propensity for anger or frustration or irritability. And there's another model called the Tao of Trauma that speaks to, when there's a danger in our environment, just like animals, that we go through these same 5 phases or 5 cycles. There was a gentleman named Peter Levine that talked about polyvagal theory, and a mentor of mine, Elaine Duncan, who developed this Tao of Trauma. And the wood aspect in this cycle is what mobilizes a response. So if there's some danger in our environment, then we're first aroused, that's the metal element. And then there's a signal for threat, and then we mobilize a response. So trauma in this paradigm is considered to be too much, too fast without adequate support. And then we have our natural responses: fight, flight, or freeze, or fawn. And none of those are wrong. They're all ways that we survive and respond to danger in our environments. And then these 5 self-protective responses correspond with each of the elements. So again, the wood element is that mobilization, and it's also considered our sympathetic nervous system. So we're going to talk a little bit about how to calm our sympathetic nervous system, but first I want to show you a couple more slides. So on the left, you'll see here, there's sort of this highway here with a wave in the middle, and you can imagine this to be sort of our zone of resilience, how we deal with stress. And you can see the yin and yang aspects within that wave. So awake and alert, and then rest and digest, inhale and exhale, daytime and nighttime. But when we have a stressor, sometimes we get some activation that knocks us out of that zone of resilience. And then sometimes after that activation, we may fall into a freeze response, but eventually we're going to find our way back to that natural flow. And that's the job of our parasympathetic nervous system. So it helps to balance and bring us back into regulation. But sometimes if we have several stressors or more significant life threat, we may find ourselves in this dysregulated state where it's hard to turn our sympathetic nervous system off, and we become dysregulated. And that can manifest as lots of different symptoms: headaches, poor sleep, fibromyalgia, like lots of different things that are maybe obscure and hard to treat, hard to get at. But in Chinese medicine, they're all sort of related to these stressors that we experience. So these, there are also 5 capacities that are related to the 5 elements. So for example, the metal element, when we are aroused, but we also can be curious, like maybe it's not a snake that we see, it's actually a rope. So the wood's job in this sense is to mobilize a response that's commiserate with the level of threat. So there may be things from our past that that did require more mobilization, and we respond from that same place. But in this case, we need to be curious and recognize that it's a rope and not a snake, and then bring ourselves back into regulation. So restoring balance in any member of a system, like the family or a workplace or a neighborhood, can impact the whole system. And when we can find coherence, it creates more coherence, sort of like honey spreading on warm toast. So this work, treating trauma, is really world healing in our communities at work, in our communities where we live. So learning how to turn on our parasympathetic and come back into regulation is an important capacity. So I wanted to share a little bit about TCM diagnosis. Wang Wenwen Jie is the traditional words that are used to describe how we diagnose in Chinese medicine. So first we're going to look and then listen or smell and then ask some questions and then do some palpation. TCM diagnosis also includes pulse and tongue diagnosis. So first there's observation. This picture here on the right shows some of the functions of the liver in Chinese medicine, but we're going to look at the patient's posture, their body constitution. There's even facial diagnosis based on the complexion and personality traits that would be associated with a particular organ or imbalance. And then listening and smelling, again, the sound of a person's footsteps, their voice quality, the breathing sounds, and even breath and body odors can give us some insights. And I'll refer to this picture here a little bit later, but you can see that the ear is also sort of a hologram of our body. So you can imagine a baby or a fetus with the head at the earlobe and the arms and legs and around the outside, and then the internal organs toward the middle. So we can use the ear actually to treat the whole body. And then we're going to ask some questions. Intake at a Chinese medicine practitioner's office is different than your primary care doctor, but these are, from the picture here, you can see some of the conditions that would indicate a liver imbalance, which is associated with the spring season. We're more prone to these at this time of year. And then we're going to palpate. So not only noticing the texture and temperature of the skin, but we're also going to do pulse diagnosis on the radial artery. Abdominal and channel palpation are also part of our training. So the pulse diagnosis, if you, I don't know if you guys want to try this. We raise your left hand and wrap your 3 fingers around, and there'll be 3 pulse positions. So the liver pulse is actually the middle finger on the left wrist. And one of the common pulse qualities that is used to describe the liver is a wiry pulse. So you can imagine how your finger might feel when it was on the string of a guitar or an instrument. That's the wiry quality. We use pulse diagnosis to help understand what's going on with the internal organs. And then there's tongue diagnosis. So the liver and gallbladder, which is a paired organ with the liver in Chinese medicine, are presented on the sides of the tongue. So if you have your cameras with you or a mirror nearby, you can take a look at your tongue and see, is there some puffiness there? Maybe some a different shade of color with the tongue body, perhaps some prickles on the side. Those would all indicate different conditions that were related to the liver. But you can see also here from the tongue map that there's a place on the tongue for many of the organs in the body. And then there's 8 principles that we also use for diagnosis. So the yin and yang that we spoke of earlier, but also there can be excess or deficiency, heat or cold, internal or external conditions. And we're taking all those into account as we make a TCM diagnosis. There's also Zhang Fu organ diagnosis. The Zhang are the solid organs in the body and the Fu are the hollow organs. So all the organs of digestion from the mouth all the way down, those are considered the Fu organs, and the Zhang are the heart, lungs, liver, and spleen. And then there's also channel pathology, and we'll look at the meridians for the liver and gallbladder channels a little bit later. But if there's a condition along the liver or gallbladder channel on the physical body, then that would be part of our diagnosis. There's also 6 evils in Chinese medicine, and wind is the elemental aspect that's associated with the liver. So some things that are associated with internal wind are things like tremors or stroke, paralysis symptoms, and external wind would be things like cold and flu symptoms or respiratory illnesses that come in from the outside. In today's language, that would be, infections like viral infections or bacterial infections that we get from our environment. So what are some other TC modalities? We know about acupuncture. There's auricular acupuncture that's limited just to the ear, also scalp acupuncture, and we do different types of stimulation. Some is manual with our hands, but also electrical stimulation that uses a device that you see here in the bottom right. There's actually over 2,000 acupuncture points. But if you're scared of needles, don't worry. There's other modalities that we can use, including this modality called ear seeds, which applies pressure by applying a seed. Typically, they're made of different things, but vicarious seeds or other metals. And they're put on particular points on the ear, just like that map that you saw earlier. So depending on what condition you may be suffering from, we can choose a point on the ear to place an ear seed. They stay on for several days, and you can massage them to apply acupressure to that point. And that can, sometimes it can be effective, not quite as effective as needles, but still effective. So the WHO is the World Health Organization, and they years ago identified 28 diseases, symptoms, and conditions that acupuncture has been proven through controlled trials to be effective for, and another 63 where they found therapeutic effect, but more research is needed. And since that time, more and more research has come out. And I've just highlighted here, we'll skim through these slides for time's sake, but some of the conditions that might be related to either the wood element or the spring season or the liver itself. So you can see lots of different body systems. The sense organ that's associated with the liver is the eyes, and any spasms, that would be a wind condition. Gynecological conditions are also associated with the liver in Chinese medicine. And then the liver also helps to regulate our emotions. Psychological disorders like anxiety and depression, even PTSD, OCD, they can be treated from the perspective of the liver or the wood. There's herbal medicine is also a component of Chinese medicine. There are over 300 common single herbs and 200 classic herbal formulas. And those are prepared either bulk herbs that you would boil to make a tea, or granules that are dissolved in water, or tea pills, which could be swallowed. And these can interact with your prescription medication. So it's really important to have your acupuncturist or your herbalist be in communication with your physician, and make sure that everyone's on the same page before you start any herbal regimen. Other modalities in Chinese medicine include moxibustion, cupping, gua sha, tui na, and tai chi or qigong, and we'll talk about each of these briefly. Moxa or moxibustion is the burning of herbal leaves on or near the body. This is an example of on the body, and we put some burn cream there as a barrier so the skin doesn't burn, but it penetrates the heat deeply within the tissue. Cupping is another common modality in Chinese medicine. You may have seen there was an Olympic swimmer who got cupping, and you could see the sort of the purple spots on his back and shoulders. This is a result of the cups, and that does go away with time, but it brings blood and circulation to the area to relieve soreness and aching. Gua sha is another method that we use traditionally with a stone called bianshi, which is a smooth-edged stone, and we scrape the skin to bring the blood and circulation to that area. So you can see there immediately after the treatment, there's quite a lot of sha is what it's called, this purple or red response. This is actually really helpful for cold and flu symptoms. When it's done here in the neck and shoulders, also can relieve tension there. And just 2 days later, 48 hours later, most of that coloring is gone. So it doesn't leave any marks permanently. And then tui na, which literally means push and grab, tui na, is a type of Chinese medical massage, not your Swedish massage. It's very specific to Chinese medicine. Not often practiced here in the US. And then, of course, Tai Chi and Qigong, which are movement and concentration exercises that you can find at your local community center, also help to cultivate our inner strength and vitality. So let's talk a little bit about spring and what's related to spring in Chinese medicine. We've mentioned the element wood, the environmental weather pattern of wind, the liver and gallbladder are the organs associated with the wood, and you can see their meridians here. So the liver meridian runs up from the big toe, up the inner aspect of the leg to the abdomen, and then you can see the gallbladder channel is on the outer edge of the foot and travels up the outside of the leg and the side of the body and crisscrosses over the head. We talked about the sense organ being the eyes. The reason I wanted to talk about strains and sprains today is because the wood element, the tissue that's associated with that is our tendons. So our tendons, as you may know, is what connects our bones to our muscles. And in the springtime, we're really prone to strains and sprains, which we'll talk a little bit about later. And the taste is a sour flavor. And the emotions, again, are anger and beneficence. So some of the symptoms that you may experience if you have imbalance in the liver, and which may be more common in the spring season, are temporal headache. That's a headache that's here on the side of the head, depression or irritability, because of the correspondence with the eyes, blurred vision or floaters. Any rib pain, especially if it's moving, anything that moves to different places in the body in Chinese medicine is a wind pattern typically, so moving rib pain. And because of the gallbladder channel being along the sides of the body, that area would be related to the wood element. And also PMS or tender breasts or bloating, this can all be symptoms that are associated with liver imbalance. And gallbladder imbalance may look like shoulder tension because of where the channel crosses the body, even nausea and vomiting. And because Chinese medicine isn't just about the physical body, it's also about our mental emotional state. There are other metaphysical aspects like lacking courage or having low self-esteem or trouble making decisions that can be implicated by an imbalance in the gallbladder. So the ancient Chinese believed that humans are microcosms of the larger universe, and we're interconnected with nature. And so a balance between health and disease is one of the key concepts, and finding that balance requires treatment that's really specific to the individual. So it's sometimes I use the word boutique medicine. It's really about where you are in your life, like if you're in the springtime of your life or the summer, or if you're an elder in the winter of your life. But also, what season are we in right now when you're having this imbalance? That also plays a role. So the treatment needs to be really specific to the individual, and it depends on the pattern of disharmony that we're seeing. So is there excess or deficiency? Is there more heat or cold? Are there internal or external factors? All that needs to be considered. And this chart on the right has a lot of things going on, but it's really just to show that there's different ways that the liver can be imbalanced. And then the symptoms are going to be, and emotions are going to be different. And some foods that we might recommend will also be adjusted. All this is to say, sometimes people in the springtime, it's a time to do a cleansing or like a detox or like a juice cleanse, and that may not be for everyone's system. So for example, if you have a deficiency pattern, which could be related to just age or also any chronic illness. Women who are postpartum are also in a deficient state as they recover from having a child, premature children, or even those of us who may be suffering with long COVID. These are all sort of have some aspect of deficiency. And so that's going to be treated differently. And we wouldn't want to do any sort of harsh cleansing at any time, but certainly not in the spring. Now we'll talk a little bit about some emotional self-care and sort of the metaphysical, mental, emotional aspects of the spring season. So we just had the equinox on the 19th. And just like in the springtime, plants sprout and they move around obstacles to reach toward the sun. The wood energy of the spring also brings creativity and action and assertiveness. This information actually came from a newsletter I got from a local acupuncture clinic in Silver Spring. So when we're out of balance, we may notice that we have some timidity or irritability, some inflexibility, both physically or emotionally. That can look like indecision, which is again related to the gallbladder, headaches, vision changes, menstrual issues, digestive upset, or just not sleeping well. I know many people with the time change are still trying to adjust, and that can be also impeded just in this spring season. So some tips and tricks that also came from this newsletter. I'm just sharing them with you. I did ask for permission. Set some SMART goals. And then really take the time to feel the satisfaction when you accomplish those goals. One quality of the liver and of this springtime, as we're wanting to do more, we're coming out of a winter where we might have been doing less, and we can sort of overcommit ourselves. So setting some boundaries, practicing saying no and also yes, but both firmly and really clearly. Taking some time to reorganize. Some may think of this as spring cleaning, but you can just start with a small corner of your desk or a drawer in your home, and then take your time to work through the other areas. Being creative, making a plan, writing poetry, singing, drawing, dancing, all the ways that we can be creative in this time of year. And because of the liver's association with the negative emotion of anger, we want to vent that anger, but in healthy ways. So if you want to sit in your car and scream or throw apples at a tree or pound a pillow, we need to vent that anger and let it move up and out in a safe way, not keep it in our bodies where it can cause damage. And also practice bending. So just being flexible, both physically, but also mentally in this time of year is a really healthy habit. So some acupressure for spring. I've chosen 2 points to share with you all. The point on the liver channel is liver 3 or Taichung. It's called the Great Rushing. You can see there from the image, it's just between the big toe and the second toe, further down on the foot. And if you palpate that from the top, just using your index finger to press, you may notice some tenderness there. And you can massage that area to help relieve some tension in the liver. There's another point on the gallbladder channel, gallbladder 34. The Chinese name is Yangling Quan, which means young mound spring. And that's on the side of the leg. So there are 2 bones in the leg, and it's just where they meet. And this point is also sometimes tender, but you'll definitely notice a different quality when you press it versus maybe other areas nearby. And then you'll know you have found the right place. So if you feel the bone on the side of just below the side of your knee, and then just down below that, there's a depression, that would be where this point is. And this is one of my favorite parts of offering these presentations is the healing sound. So even though everyone's muted, I would love for us to practice this together. So you can see here from the chart, there's healing sounds that are associated with each of the organs. And the sound for the liver is shh or shoo. And it's with the tongue near the palate of the mouth. And the arms are stretched overhead. So this stretches the gallbladder channel that runs along the side of the body. And the head will be up in this position. So I'll demonstrate, but I would love to know in the ether that others are practicing this sound together with me. So we'll do it 3 times. If you want to raise your hands above your head and turn your head up, and we'll go shh. One more time, you may imagine the color green. Shh. You may even feel some energy moving up through your hands. And the last time, maybe letting some anger go through your hands. Shh. Letting that energy move up and out through the body. One other visual that you can use while making this sound is sort of like a snake shedding its skin. So you can imagine after some hibernation and it's springtime, and then they shed their skin and sort of letting go of things that are not needed anymore. So a little bit about allergies. How do you know if you have allergies or COVID or the flu? Three things to discuss with your doctor. Are you having these symptoms at a particular time of year, every year consistently? Do you have any itching with your eyes or your nose? That is probably an indication that it's an allergy. But if you have a fever, for sure it may be something different, and it's important to see your doctor or do a COVID test. So we all know what the symptoms of COVID are. I first prepared this presentation back in a couple years ago. This is actually my positive COVID test. I had to cancel the presentation at that time, but I think we're familiar, but definitely if you have a fever or any of these symptoms, it's important to test. It's still going around, and the flu as well. So distinguishing between what may be a seasonal allergy and what may be a respiratory illness can be a little tricky. So be sure to discuss that with your physician. And I want to share some acupressure also, and some things that you can do to help treat seasonal allergies. Primarily, first, limiting pro-inflammatory foods. Now, you may be thinking, what are pro-inflammatory foods? There's lots of opinions out there, but certainly anything that's white sugar, white bread, white flour, processed foods, nightshade vegetables, that's peppers and tomatoes, eggplant, and then foods that cause allergies. For other people, you may be having like a low, maybe not a full-blown allergy, but some allergic response creating inflammation, things like dairy, gluten, soy, corn, and sugar. So limiting those things and also incorporating more anti-inflammatory herbs and spices. Ginger, turmeric, and cinnamon are three wonderful spices that are anti-inflammatory that you can incorporate into your food or have as tea, that should help reduce the inflammation and then this load on your system to help relieve that allergy symptoms. There's also specific Tai Chi and Qigong exercises for the liver and gallbladder, which I'm not able to demonstrate today, but I know there's a lot of community centers that offer Tai Chi classes, and even our WellWorks here at Suburban often has a Tai Chi class running. So I encourage you to seek those out. And then acupressure for allergies, you can see the map here. So the gallbladder channel crisscrosses across the side of the head, and all these points, you can just take your hand like this and massage or press. That will help. And any of these points along the nose, you can see also will help. And on the back of the leg and on the forefinger here, the index finger. These are points that are helpful for sinus congestion and allergies. So strains and sprains, why are they more common in the springtime? Because typically we do too much too quickly. And as a result, this is a hike that I went on out in California. I was visiting a friend, and it was the spring season, and I had not been outdoors in a while, and I overdid it and twisted my ankle. So you can see here, there's a lot of swelling around my ankle. Luckily, I was visiting a colleague who's an acupuncturist, so she was able to give me a treatment. But the tissue, again, associated with the spring and the liver is the tendon. And so when we do too much too fast and we haven't taken time to warm up our bodies and stretch, then we can be more prone to injury. So the tendons, which connect our bones to our muscles, and again, the energetic movement of the spring is up and out. So we want to get moving, but we need to remember to be sure to stretch and warm up and go slowly at first. After sort of hibernating in the winter, if you will. So these are some recommendations for strains and sprains. Certainly ice in the acute phase, although Chinese medicine is not generally a fan of ice at any point, within the first 24 hours for acute inflammation, it is recommended. And then heat after that to promote circulation and movement. These two products are very commonly used by practitioners, Yunnan Baiyao or Zhenggu Shui. Both can be very helpful for minor injuries, strains, and sprains. Zhenggu Shui literally means like upright bone water. So it can be helpful, but it's really important also to get checked out by your provider. Maybe it's more than a strain or sprain, so just be sure that you've been seen to make sure that there's no fracture or something more serious. Some more common things that you may be able to use and find at your local pharmacy are arnica oil, which helps with pain, or something like tiger balm that will increase the circulation in the area to relieve pain. You can also, oh, I have a misspelling here. It's pao jiao, P-A-O, is the Chinese term for soaking our feet. So an herbal foot bath could also be helpful to reduce inflammation. Some cooling herbs that you could use initially, mint or cucumber or dandelion root, you can get in the form of tea bags at your local grocery store initially, and then maybe some warming herbs like ginger or cinnamon or clove with Epsom salts to promote circulation and reduce the swelling. These are some references. I guess I went really fast. These are some references that are the source of some of the things that I shared. And I guess, do we have time for questions? I can also show a quick 3-minute video since I went so quickly.
We want to show the video and then we can get into
Yeah.
questions.
I had this earlier in the presentation, but because I had so much information to share, I just put it here at the end. It's a great example of acupuncture being used in a local emergency room to treat pain. Let's watch it together.
Nausea, all common conditions that doctors say can land people in the emergency room. But one local hospital is offering patients a new option to eliminate pain. Mary Stoker-Smith explains it's based on a practice that's thousands of years old. It's a place where,
The typical day is that nothing's typical.
and inside,
There's some days where we see more minor cases, and some days where we have people that need full resuscitation.
no matter the day when someone walks in,
If anybody presents to the emergency department with what they consider an emergent condition, we will evaluate and treat them.
but at the Aurora West Dallas Emergency Department, traditional treatment is being turned upside down with traditional Chinese medicine.
Acupuncture has been around for thousands of years.
It's been less than 2 years this ER has offered the alternative.
I was skeptical. I wasn't sure. I knew of the practice, but I didn't know how it would work.
It's a natural, non-pharmacological way to reduce pain.
That means no medicine at all.
This one is one of the most common relaxing point that we use here.
An option emergency room doctors want for their patients.
We have a real problem with narcotic opiate abuse and addiction in this country.
We are currently in the throes of a opioid crisis.
It's just great to have an alternative to prescribing narcotics for some of these conditions.
Conditions that are all too familiar in the ER.
Pain is a very common presentation to the emergency department.
I was just nauseous and pain head to toe and pretty much in fetal position.
Barbara Orban opted for needles over narcotics during her hospital visit.
And I was like, absolutely, whatever it takes to get rid of this pain.
Even she admits
I was like, what? You can't possibly tell me that sticking needles in my body is going to take away this pain that I have.
hours later,
They hadn't given me anything other than fluids and the acupuncture. And I walked up 2 hours later, it was unbelievable. Unbelievable.
doctors know acupuncture won't fix everything.
There are some cases where it's appropriate that we do use opiates or narcotics to treat pain.
But are glad to have an atypical option
The benefits are many.
in a place where nothing is typical. Mary Stoker-Smith, Fox 6 News.
Aurora says so far, more than half the patients offered the alternative have tried it.
It was an accident a few years ago and was treated with acupuncture. I'm a firm believer in it. It does amazing results, has amazing results. Yeah,
Interesting.
good for them.
Definitely another option.
Yeah.
But we want to check.
Okay, so we'll go back to the Q&A section.
Thank you so much, Kim. That was wonderful.
Of course. Yeah, sorry, maybe I spoke too fast. Forgive me if I went too fast. I'm happy to go back and clarify anything for anyone.
Thank you. Okay, our first question, is there any cure for arthritis in hands or recommendations?
That's a great question. Arthritis is a form of inflammation. It depends on what type of arthritis it is. There's osteoarthritis and rheumatoid arthritis. And it also might depend on which part of the hand, but certainly focusing on lowering the level of inflammation in the body, reducing the pro-inflammatory foods and increasing anti-inflammatory, using those herbs and spices that we talked about, keeping your hands warm, especially in the wintertime. And it really depends, I guess, on the individual and what's the cause of the arthritis. But yes, acupuncture can be helpful. But certainly also things you can do for yourself, like lowering the inflammation in your body overall with diet. Mhm.
Thank you.
Mhm.
Okay, and what is fawn? Going back to the
Fawn.
beginning.
Fawn is a very complex response. So there's fight, flight, and freeze. And fawn is sort of where there's a lot of anger inside, but maybe the person is in a position of power. So we need to pretend like we like them, but really we're scared inside. So that's a fawn response.
Thanks for the clarification.
Mhm.
Do you recommend local honey to reduce allergies in the spring?
That's a great point. Yes, that's not from Chinese medicine, but we do know that if the bees have used local flowers, then the honey that comes from them should have more benefit for our allergies. Yes.
Thank you so much.
Mhm.
And just as a reminder, if you have any questions, to put them in the Q&A box rather than the raise hand feature. But another question, so we talked about, as we head into the spring, but, throughout this springtime, is there anything we should be thinking about in preparation for the summer?
So from my perspective, yeah, I guess just now, since it's still we're having these cold snaps, I'm thinking more about taking things slow and warming up as we begin to move. But the summer element is the fire element, and there's a lot more heat that's generated in that season. But certainly we want to sort of shake off the things that aren't needed from the winter as we move into the summer. And that's what the springtime is really for. So we tend to eat heavier foods in the winter, maybe more meats if you're a meat eater, also just soups and stews and heavy foods. And in the springtime, we're beginning to have more greens, salad greens. People often do like green cleanses. And then in the summertime is when we're going to have the lightest foods and more fruits and things like that available. So eating with the season is helpful, like things that are growing naturally in our area. That helps us to keep with the seasons as we move forward. Mhm. I don't know if that answered the question.
Yeah, absolutely. Thank you. What is the difference between dry needling and acupuncture?
Oh, that's a great question. There's so dry needling is done by physical therapists and others who have done a different type of training. So I can't speak to that as much as I can speak to what acupuncture is. And most acupuncturists have the entry level as a master's degree in the United States. Our training is like 3,000 hours. So I went to school for 3.5 years to get that master's, and that includes a lot of training time. Sometimes my understanding is that the dry needling is typically done on trigger points in the body. It tends to be, I've heard, more painful, and is really they're needling at the direct place where there's pain. Acupuncture is more subtle. We often can use distal points on the body along the meridians to treat something without needling where the pain is exactly. I think in summary, dry needling really focuses on trigger points and a lot of manipulation of the needle. And acupuncture is based on a much broader theory with diagnosis and more subtle treatment.
Great, thank you. And in traditional Chinese medicine, is there any cure for bad breath?
So bad breath can have different causes, but it's coming from the stomach. And from a Chinese medicine perspective, we might look at that as a stomach heat. And so we would treat that using different points to treat the stomach heat. And we also might make some dietary suggestions to quell that heat.
Great, thank you. And I'm not sure if this question is in reference to the video we were shown in the emergency room, but the question is, does Suburban Hospital use acupuncture?
I would love for them to. That's my dream. There is acupuncture available through Hopkins. There's an integrative practice that's based in Baltimore. I've met with the acupuncturist there. His name is Jeff Gould. If you have Hopkins insurance, if you're an employee at Hopkins, the EHP does cover acupuncture. Most insurance covers acupuncture nowadays. There used to be an integrative center at Sibley, and I would love to see that offered here, inpatient or outpatient. You could ask your physician for a referral if they're part of the Hopkins system, and Jeff gets all those referrals. So people that are referred that are in this area and don't want to travel to Baltimore, he refers out to private clinics in the community.
Great, thank you.
Mhm.
So how are the pressure points used for allergies, and can we use those pressure points ourselves?
Yes, absolutely. This talk was all about really empowering you all to be able to have some extra tools to treat yourself for allergies and strains and sprains and things. So massaging the points that you saw in the photo, and you'll get the recording afterwards so you can review when you're having symptoms, certainly. So you want to massage, usually bilaterally. I like to do gentle circles for a minute or two, several times a day, or when you're feeling your symptoms more strongly. Yes, absolutely. You can do that yourself.
Great, thank you. And as Kim mentioned, the presentation is being recorded and will be sent out to you after. Okay, our next question, how to treat numbness in the thumb from cervical stenosis surgery?
That sounds like a question for a physician, but how we might treat it in an acupuncture clinic. If we know that it's coming here from the neck, then we can treat locally here with needles around the neck to reduce the inflammation there where the nerve's being pinched. And then there's more flow to the distal area where you're experiencing the numbness. So we could focus on the neck since we know it's from cervical stenosis, but also we can focus locally to bring more what we call chi and blood to the area to increase the sensation.
Thank you.
Mhm.
Have you had some success with migraine patients using acupuncture?
One thing about Chinese medicine is yes, there are lots of different causes for the same symptoms that we may experience. So that's where seeing an experienced provider who can give you a different, who can differential diagnose what's the cause of your migraine. From a Western perspective, there might be just one reason and we have medications to take. But from a Chinese medicine perspective, there could be lots of different causes. Sometimes it's a liver imbalance. Other times it may be from some other organ or system. And so first, having a practitioner that can identify what the root cause is and then treating it from that root cause. Headaches are easy to treat for the most part with Chinese medicine, both acupuncture and herbs. But what's most important is identifying for the individual, what's the cause of the migraine.
Thank you. Is it normal to be sore, almost in more pain after an acupuncture treatment? Does it take time for the nervous system to settle and the healing to start?
Oh, that's a great question. It is possible to overtreat, and sometimes there's a lot of apprehension about the needles, and our bodies are really braced and tight. And if the practitioner isn't normal, to answer your question, it can happen. What might be happening is that your body's very braced and tight before you receive the needles. So being able to have a little bit of time to calm the sympathetic nervous system before the needles are placed may give you a better effect. But typically there's relief from symptoms after the acupuncture treatment.
Great. And we have a question about where to contact you. So if you don't mind.
Yeah.
doing that.
This is
Perfect.
so I'm also a community health nurse here at Suburban. And this is my work email, so feel free to reach out and I'm happy to answer any further questions that you might have.
Thank you. It looks like we have one more question, and if anyone else has a question, please feel free. Okay, we have multiple questions. So,
Mhm.
can acupuncture treat several conditions at the same time?
It can. I think it's easier to focus on one thing when we're choosing points and we don't want to overstimulate or treat from too many perspectives. We want the signal to be really clear. So it is best to focus on sometimes the symptoms are interrelated and we can treat many symptoms from one diagnosis. But if the symptoms are related to different conditions then that aren't related, then it might be best to focus on one thing at a time. But it depends on the specific instance, I would say.
Oops.
Mhm.
Okay, and we have mugwort leaves. What do you use it to cure?
Yeah, mugwort is the leaf that's used to make the moxa that we talked about for the moxibustion. So mugwort grows really easily and it can be made into salves or things, or it can be processed and then used as moxa by a practitioner, not for yourself. It's a very warming herb. In China, I think they may even eat it like in a dietary way. We don't typically do that here. It's very warming. Yeah.
Thank you so much. Thank you, Kim, for sharing your time with us today. Um, we have another question. Can
Hmm.
acupuncture treat for inflammation in the body?
Absolutely. Yeah, that's one of the things that's really good at because it increases the circulation to areas that might have less circulation. Then it can help to reduce inflammation for sure. Along with other practices like Tai Chi and Qigong, inflammation is really compounded by a stress and the high cortisol levels in our bodies. So acupuncture also helps to calm our nervous system. And then dietary changes that your acupuncturist would recommend for your particular case to help reduce the overall inflammation in your body. But being able to calm our nervous systems, I think, can make one of the biggest impacts on inflammation just by reducing cortisol levels and lowering our stress.
Thank you. And can acupuncture treat high blood pressure, specifically the use of auricular acupuncture?
I would say yes. Yeah, there's a study I didn't offer. I took it out just before we started, but there's lots of research out of UC Irvine using electroacupuncture to treat blood pressure. But there's lots of different modalities. As I mentioned, hypertension from a Western medicine standpoint is hypertension, and we treat it with particular medications. But in Chinese medicine, that could be due to a liver imbalance or a heart imbalance or a kidney imbalance. And so we first need to identify what's the root cause of this particular individual's hypertension and then treat it from that perspective. But certainly it can help. What we do want to be working alongside your physician if you're taking medication to make, just so that everyone's on the same page. But my advisor in China, he was a cardiac specialist and he treated patients with high blood pressure and stroke and lots of other heart conditions with herbal medicine and acupuncture as well. So yes.
Great. Thank you so much. And we have a thank you message in the chat as well. Thank you for your easily understood explanations and introduction to Chinese medicine. So thank you all. And again, if you have any questions, please don't hesitate to reach out to Kim. Thank you for sharing your time with us today. And thank you everyone for joining and having some great questions as well. All right, and have a great rest of your Thursday. Thank you so much.
Thank you.